So, are we ready to start, do you think?
I think so. Yeah, absolutely. Yeah.
Good. So, hello, whoever is out there. My name's Ruth. I'm the director of the Miscarriage Association, which is a charity that offers support and information to anyone who's been affected by, well, miscarriage, but also ectopic pregnancy and molar pregnancy, which are two other kinds of pregnancy loss. And I'm really happy to be here talking with Ted, or CBT Ted. Um, so you're a therapist and a coach, and I found out about you because we got a message via LinkedIn to say that you've been talking. I know you're talking generally at the moment about prenatal and postnatal mental health, but you shared something on Friday where you were talking about miscarriage in particular. So maybe you'll say something about what led you to do that.
Sure. So, in my experience as a therapist, one of the things that sort of frustrated me the moment I started learning about this stuff is, hold on, why don't we talk about this stuff more often before somebody gets into a really difficult place? And my experience more often than not is when you feel very anxious or when you feel really low or affected by something, often you feel like you're being silly or there's something wrong with the way that you feel. And I've really heard a lot of stories from people when it comes to miscarriage about feeling like, how could I feel loss for something that I never actually had? Or how can I miss somebody that I never actually got to meet? And it makes sense that we might feel that way, but from the outside, it tends to be perhaps a bit easier to see that actually, of course, it's reasonable to feel that way. And I wanted to kind of express how that works. So in particular, the idea that you don't just lose a pregnancy, you lose the whole future that you were going to have with that child, with that adult. You picture their wedding, you picture being a grandparent, you picture all of that. And it's that you lose as well, along with lots of other things. So my main sort of intention there, I suppose, was just kind of to say it is reasonable. It's much more reasonable than we perhaps think to be affected by these things.
Yeah, and as you say, when I think for many, if not most people, when they do a pregnancy test and they see the positive pregnancy test result, they think baby. And actually that can be true of people who don't particularly want to be pregnant and who are not wanting this pregnancy to continue. But people think baby, and if you have a miscarriage, if you lose that pregnancy, you're not losing just a pregnancy. You're losing the baby, and as you say, the hopes and the dreams and the plans. And in my case, the argument about whether or not if it were a girl, she would have earrings, we would allow her to have her ears pierced. She's now 38 and she does have her ears pierced, just in case anybody wants to know. I think it might be interesting. I mean, I think we're going to focus today. We had a discussion after that meeting, didn't we? After we chatted, and we thought that we would focus really on pregnancy after loss, because that's something that I think a lot of people in the sort of family and friends, people who've been through pregnancy are thrilled to know that they're pregnant again, and they're busy telling them that it's going to be absolutely fine this time, and that's not necessarily how people feel. But I thought before we get started on that, it might be really useful for you to say something about CBT. What is it? Why is it different from, I don't know, counselling or psychotherapy or any other kind of help?
Sure, thank you. That's useful. So, I mean, CBT, so it's a combination of two things. So it's cognitive therapy and behavioural therapy, which again probably still doesn't mean anything, but practically speaking, what it means is it's specifically focusing on really understanding how things work. So counselling, person-centred counselling, tends to be, the idea is you go, and the benefit is in being able to talk and have somebody truly listen to you and truly understand you. And that can be really, really useful, particularly when it comes to things like loss, because your friends and family might try their best, but they often try to make you feel better. And actually, that's quite hard. CBT isn't just about listening, if you like. It's not assumed that's the only thing that's going to help. What we're usually trying to do is understand why it might be happening. So, for example, with anxiety about being pregnant, trying to understand why it might make sense, actually, particularly based on your previous experiences. So that's a shared thing from any other psychological approach really is it's assumed that your previous experiences affect the way you feel now. So if you've been bitten by a dog, you are more likely to be afraid of dogs. You are more likely to be anxious about your pregnancy or losing your pregnancy if you've lost one before. That's not your brain malfunctioning, that's your brain functioning perfectly well. But then the question is, okay, what do I do about that? How do I help myself with that? And that's the tricky part usually.
So in the therapy, it's talking, it's figuring it out, it's seeing what is completely understandable in those circumstances, but also presumably helping people to kind of deal with it, to get through it, even to find tips. And you know, if you Google anxiety and how do I get through it, you'll come across a zillion different things, from I don't know, from counseling through to acupuncture through to pretty much anything. And of course, it's never the same for everyone. Different people have different experiences and have different needs. And I guess feel comfortable with different kinds of help.
Absolutely, and finding the right kind of approach for you is important. Sometimes people have quite a negative experience with CBT actually, and usually that can come, so there's kind of different levels of CBT that you can get depending on how severe we might think the problem is. And sometimes when you go for sort of short versions of CBT, this is a role that I held when I first got into this, you get somebody that's only just really learning this stuff. And what we think our job is to help somebody change the way they feel by changing the way they think. But that is not going to work for loss, because the way that you feel is reasonable. The way that you feel is completely reasonable. For us to try and tell you that you need to think about it differently is ridiculous and really unhelpful, and it can feel kind of insulting actually. So part of this skill, or part of what we're trying to do, is first and foremost, let's help you understand how reasonable this is, because then our choice on what we do is different, and usually it's behavioural. So once I've noticed that actually, yes, I do feel really anxious about this, part of the question is, what am I now finding myself doing? Is that helping me or is it hindering? So checking things a lot, for example, reaching, I'm trying to get some reassurance, but actually ultimately nobody seems to ever be able to give me enough reassurance. I'm kind of caught in a loop or caught in a cycle of just going round and round, and that can be really exhausting in itself. Usually there's things that we can do about that, for example.
Yeah, and that rings so true for, you know, thinking about people who are, you know, they've had a loss, or maybe they've had more than one loss, and now they're pregnant. And in the first place, they may have had, you know, lots of time thinking about or worrying about, when do they try again? What's their risk factor going to be? You know, are they now bound to miscarry again or not? Whether they try again. For some people, they'll just think, I don't think I can put myself through this again. And then once they are pregnant, there is very often this huge pendulum swing between hope, you know, hope here and sort of terror here, and they're moving backwards and forwards. And what you said about how people's behaviors can come into play, I think about many people say that they want to have an early scan. They want to have a scan because they don't want to be caught out as they might have been before. I think a lot of people, well, we know a lot of people will normally be offered a booking in scan or a dating scan at around 12 weeks of pregnancy. If you've had a miscarriage at, you know, 9 weeks of pregnancy or 8 weeks of pregnancy, the thought of waiting again until you're 12 weeks just feels totally impossible. So a lot of people want an early scan, often can't get it on the NHS because really it tends to be limited to if you've got symptoms, if you're bleeding. But even when people do get a scan, whether it's through the NHS or if they're going to a private clinic, there is a moment when they see the heartbeat, if they see the heartbeat, of course, when they are just hugely reassured, and it's wonderful. And then by the time they get to pick up their car or they've gone to the bus stop, that's gone. Yeah. Because they're thinking, well, it's okay today, but that doesn't mean it's going to be okay tomorrow. So I think that is the kind of thing that people are often living with, that it is continuing anxiety because you've only got through this moment. You don't know what's going to happen at the next moment. I mean, does that make sense?
It makes complete sense, and it's an impossible situation to be in, because I need the reassurance, because it's terrifying. The idea that something might have gone wrong and I don't know is terrifying. And again, part of understanding, sometimes you'll get a reaction from family or friends around you, or even medical professionals, where they're like, what are you doing? What are you worried about? There's nothing to worry about here. But that doesn't help, understandably. But it also, in your mind, you're thinking, well, how do you know? I thought one of the real difficult things about that is I thought it was okay last time.
Yeah.
I thought it was okay last time and I was wrong. So even when there's nothing happening to worry about, I still can't trust it. I'm still sat here thinking that's almost evidence that something can go wrong. So when the sea is calm, there's still something to worry about, because the shark could come out of nowhere type thing. So A, understanding that that's reasonable, but then B, kind of asking that question about, okay, so how much reassurance actually helps me, and how much am I going to have to make space for other things in my life, because it's so scary that it kind of dominates my thinking and it dominates what I want to do. So before I know it, I can spend all my time kind of feeling my belly. I can spend all my time checking my heart rate. I can spend all my time researching sort of symptoms online. I can spend all my time at the hospital. And that might be that I decide, you know what, I don't care. I'm just going to do that. I'm going to do that, and I'm going to see it through, because the idea that I might miss something is so overwhelmingly terrifying that that's the decision I'm going to make. And nobody can tell you what the right amount of precaution is. Nobody can tell you, because again, in a way, you sort of know better, because you've seen how it can go wrong. So what we have to do is try and help somebody. Particularly a little tip can be, okay, well, it's all right to seek that reassurance. That's perfectly reasonable. But if you spend even just 9 months only doing that, you're not going to be in a good headspace, even after a couple of weeks. So actually, can we make some space for connection? Because what it blocks out is your partner might be trying to talk to you and you can't, because I'm too busy thinking about this or too busy doing this. Your friends want to see you, but you can't, because I've got to go and do X, Y, and Z. I feel like I can't move, maybe. So just making a bit of space for connection or some enjoyment, actually. And again, when that carries on into when you've had the child, if you're really worried about the safety of the child, understandably, if all you spend your time doing is trying to keep them safe, you never get to have any of the connection or nice times. And that's a real tragedy, actually, because why are we trying to keep them safe? I'm trying to keep them safe because they're precious to me, and I'm missing out on them because of how I'm having to spend my time.
Yeah, I imagine though that sometimes you can have that level of understanding. You can kind of look at yourself and look at your behaviors and think, do you know what? That's understandable, but the way I'm dealing with it isn't logical. But actually moving from that point to changing anything, it's a bit like me knowing that the amount of chocolate I eat really is not good. But will that stop me eating as much chocolate? Well, possibly on a Tuesday. So it's that moving, isn't it, from having that feeling to knowing how you can deal with it. And I guess sometimes therapy can help, or talking to somebody that you trust, who isn't just going to reassure you that everything's going to be fine. And I'm thinking, when you talked about, after somebody has their baby, that it's also surely the case that some people will have postnatal depression or even postnatal psychosis.
Yeah.
People can do after any pregnancy, whether or not they've had a previous loss, but that this might also be connected with feelings of not only the anxiety and the build-up that you've had all the way along these 9 months, but also sometimes still feelings of grief and loss for the baby or the babies that you've lost. And maybe that really tricky feeling about, I wish I hadn't had that miscarriage, but if I had not had that miscarriage, I wouldn't have this baby. So how do I manage both the sadness and, and this new baby? And actually the same thing can happen if you have a multiple pregnancy. And say you have a twin pregnancy and then one twin is miscarried and the other twin survives, and everybody around you says, but at least you've got one. It's hard.
Yeah, that is really hard. I think what you say there about what you know, at least you've got one. And what people are trying to do there is make you look at the positives to try and get rid of the negative, the way that you feel. I'm going to try and make you feel better by making you look at the positives. But actually, that kind of, again, misses the point of it's okay. The two can sit together. It is perfectly reasonable and legitimate to feel loss and sorrow for the twin that you lost, and be pleased that the other twin survives. And then it gets complicated with all sorts of guilt and stuff. But the power for friends and family, not just therapists, to be able to actually just acknowledge and normalize the way that you feel, rather than making you feel like you're being weird. Because we don't mean to make people feel that way when we're trying to be positive. Like, oh, well, you know, at least we've got this, or, you know, you should be grateful for what you've got type stuff. We're trying to be positive, but actually what we're saying to that person is, you shouldn't feel the way you feel.
I absolutely agree with that. That's the same as the comments that people make, like, well, never mind, you're young, you can always try again, which may or may not be the case. Or, well, at least it wasn't a baby yet. Or actually anything that begins with at least.
Yeah, yeah, any of those.
You've got a child already, and you think, well, yes, but that doesn't mean that I didn't want this child too. And I think what you said about holding both of those things together, it's, you know, feeling the loss and the sadness about the baby or babies that are not going to live, and also feeling joy and pleasure, and at some point irritation, with the child that you've just given birth to, or with whom you're still pregnant. I think holding both of those can be very difficult if other people negate that, with the best of intentions.
Yeah, I think that's absolutely true.
Yeah.
It's the same with what people try and get us to do. Sorry, kind of just occurred to me, often people are trying to encourage you when you're really anxious about the pregnancy or about the new baby. People try and encourage you to let go of that anxiety by stopping sort of what they might see as being overly cautious. So if you don't want to leave your baby with someone, for example, they're like, oh, come on, let's just go, let's just do it. And again, what we're missing there as an outsider's perspective is, we might see that the baby is okay, but from the mother's point of view, who's just had that baby and has had all this really traumatic experience, it's scary to her. Doesn't matter whether we think it's scary to her. And actually, a kind of message that I'll often kind of work on with people, it's also how you communicate with your family and friends, because often you try and explain, and it can cause all sorts of friction between partners in particular. You don't seem to care about the safety of our child or my pregnancy as much as I do. What's wrong with you? Whereas actually, just acknowledging that you feel that way, your partner might not, you still have a right to ask for what you need, actually, and how might you put that across? So saying something like, look, I know it doesn't scare you, but it scares me. So it will really help me if you just, for this period of time, do what I'm asking you to do. I know it's not important to you. I'm not asking you to do it because it's important to you. I'm asking you to do it because it's important to me. Can you do that?
Mm.
So it's kind of practical. How do you even say those things a lot of the time as well? Because it's hard to have those conversations.
Yes, absolutely. It's much easier to storm out of the house.
Yeah.
And sadly, that can sometimes happen in these kind of really difficult life experiences. I think even when people are pregnant in the first place, and there may be a difference of feeling about what this pregnancy means to one person or to the other, that one person is really excited about the pregnancy and one person not.
Yeah. About
how they feel about a loss, that one person might be grieving and one person is going, well, do you know what, these things happen. I think people almost automatically assume it'll be the woman who's grieving and the partner who's saying, you know, let's be practical, but it doesn't necessarily work that way around.
No, and it's massive for dads, not partners, but speaking generally on behalf of men, I suppose, if I can generalize, one thing that we can say culturally is that we're not really allowed to show weakness. So the idea that I am grieving, or the idea that I should show my grief to my partner, who I know is grieving herself, the kind of default position is to hide it. And that can be really difficult too, because then the two of you try and have a conversation about how each of you feel, and it causes that clash. I'm trying not to think about it, you're making me think about it, and you feel like I'm not hearing you because you can't talk about it without me reacting, all of that stuff. It's tricky.
It's really tricky. And as you say, it can work both ways. So there may be a partner who sees their role, whether it's male or female or non-binary, they see their role as they have to be the strong, silent, supportive one. And that sort of doesn't allow for them to express any feelings of grief or loss. And similarly, in pregnancy after loss, and this is coming to me as we speak, really, that also can be the role of the partner. I'm going to be the encouraging one. I'm going to be the one that says, do you know what? We've got to 8 weeks. You didn't get to 8 weeks last time. This is absolutely brilliant. I've read somewhere that once you get to 8 weeks, you're X%. And if you're in the position of anxiety, you'll say, well, 95% is great. But how do we know I'm not the 5%? So you're always, or potentially always, looking at this in very different ways. And as you say, that can actually make life difficult in a relationship. It can exacerbate problems that already exist if you're not intercommunicating. But equally, it can be because one of the partners is not wanting to share their feelings of grief or loss or anxiety because they don't want to make life worse for the person who's already feeling that way. So there is, this isn't necessarily negative. There's no value judgment. It's that we are usually individuals with our individual feelings.
Both trying to do the right thing.
Yeah. Both for ourselves and for the other.
Yeah.
So I'm thinking about what we do here. You've talked a bit about CBT, and it's really helpful for me to learn more about what that means. So here we don't offer therapy. We absolutely don't. We don't pretend to. But what we do offer is support and information. And I think the most important words that our helpline workers offer are often the words that remain unsaid, in the sense that they listen.
Yeah.
It's the words that they don't interrupt with. It's they're not saying, I'm sure it'll be fine. What they're saying is, I think I can understand how you're feeling, or quite a lot of other people feel similarly. Something that makes people feel heard and less alone, because that matters so much. And if we were going to give a message to anybody who's hoping to be supportive to somebody who's going through a loss or had a loss, or pregnant after loss and feeling anxious, it would be just listen. Really, really listen. Don't say I'm here for you and then look at your watch. Or don't interrupt them, which, by the way, I keep doing to you during this.
Same the other way, so you're all right.
Don't know. I was thinking, so what we do here, as I say, is we offer support in that way. And that's through a helpline and live chat and email and direct messaging. And one day I will have a go at TikTok, but I'm not there yet. But what we also have is sort of peer support. And that can be either people attending a physical face-to-face group, and there are a bunch of those around the country, or attending a Zoom support group, which we suddenly learned about during COVID, the only positive that COVID brought us. And one of the Zoom groups is for people who are pregnant after loss, so that they know that they're with other people who are probably having similar sort of thoughts and feelings. And then we decided that we would also, we have a private Facebook group. We decided we would create 2 Facebook groups for people who are pregnant after loss. One for people in their first trimester, when probably the anxieties are at their peak, because a lot of people will feel somewhat better once they've got to the sort of 12, 13 week mark, but not necessarily, that doesn't necessarily stop them, which is why we have the second group. And people in that second group, when they're 30 plus weeks pregnant, are still talking about what's normal. What's
Yeah.
not normal? I've had this feeling, I've had that feeling. Should I use a Doppler? Should I be doing this? I'm worried the baby isn't moving. And people are absolutely there for them, which is so, so helpful. And nobody says, I'm sure you're going to be fine.
Yeah.
Nobody.
It's huge that this idea of it's helpful to just acknowledge and feel okay about the way that you feel, that the impact you can give to somebody by simply treating them as if the way they feel is normal and helping them feel that way. If that translates to the person who's feeling it, if the way that I feel is normal, I don't have to fight it. And often what we're doing with anxiety is we're trying to fight it. I'm trying to get rid of my anxiety by doing all this checking, by doing all these things. But actually, if I'm recognizing that I am anxious and it's totally reasonable that I'm anxious, actually, in a way, maybe I don't have to fight it as much. I can just go, I'm anxious. I am scared. It's reasonable that I'm scared. I don't have to do anything. Maybe I just need to go and get some support, speak to someone, have a hug, or whatever it might be, rather than feeling like I have to focus on all these things instead. So it's such a huge thing that you're describing there. Of what all of these peers and people involved in your organisation do. It's massive.
Well, that's why we're here, really. And I think the extra, like we don't have enough anxiety. The extra anxiety that people create when they worry, understandably, that if they're feeling anxious, it's going to somehow damage the pregnancy. So not only are you feeling anxious, but you're feeling anxious about being anxious, because that's going to make everything, doubly bad, doubly scary. And really what people need to know is that stress does not cause miscarriage or ectopic pregnancy or molar pregnancy or stillbirth or any of those. It just doesn't. I mean, there are studies out there that show that there's a connection, there's a link. Well, that's no great surprise. It just doesn't show you the direction of it.
Yeah.
So, yeah, I mean, people really need to know that that's not going to cause them any problems.
Absolutely.
I was thinking when I was planning for our discussion, and I mentioned to you before we came on live that I was kind of anxious about it because of the tech and because I would forget what it was that we wanted to cover. So of course I left it till the last minute, which really added to my level of anxiety. I share this with you people. But I was also thinking about how incredibly, this sounds banal really, how incredibly individual these experiences are. And I think you said earlier that it depends on what's happened before, but it also depends on the kind of person you are. So some people who are pregnant after loss are very, very positive. They just think, do you know what? These things happen. I read somewhere that it's 1 in 4. And, let's just try again. I'm sure it'll be fine. And they might have a bit of passing anxiety here and there, but actually they feel really positive, and as long as the pregnancy continues okay, they are pretty much okay. And there are others whose personality is different. They are natural born worriers, and that will feed into it. But there are also people whose feelings about the pregnancy differ. So, what does this pregnancy mean to me? What did the pregnancy or pregnancies I lost mean to me? Is this our last chance at having a baby? Because we've been through fertility treatment. It took me ages to get pregnant. And then I had a miscarriage. And now this is the only one that we can, maybe afford or are offered by the NHS or that we can put ourselves through. So, or if you've had many losses.
Yeah.
All of those circumstances can make this time, which, might feel like a time of trial, the longest 9 months ever. And the only joy is that you tend not to know too much about the first 4 weeks, unless this too is a pregnancy, an IVF pregnancy, and from even earlier.
Yeah.
You're always thinking about the end result. And I think of someone who I spoke to once who was very, very, I met her in a different context, not at work, and she was very heavily pregnant. And because she knew where I worked, because it came up in conversation, she talked about the fact that she has a son, a toddler, and then she became pregnant again and had a miscarriage, which was a tremendous shock to her because it didn't occur to her that anything could go wrong.
Mm.
And then she became pregnant again and was fairly anxious, but sort of managing it. But actually, the further along she got, the more she became anxious. And when she got to, I think, 37 weeks, she was asking her doctors if she could be induced because they kept saying, I don't know what you're worried about. And she was saying, well, because unless and until I have this baby in my hands, in my arms, I'm absolutely never, ever going to expect that the rug won't be taken from under me. And that's such a sad, hard way to go through pregnancy, and sadly it can be that way for people. So
yeah,
I guess what's really important is that between your service and our service and all the different ways that family and friends can help, you just really want to help people through so that it's not 9 months of distress or anxiety. I mean, you can't stop it, but it's finding the right balance, really, isn't it?
Yeah, absolutely. I think it always starts with acknowledging that it's okay to feel that way. The mistake we often make as helpers from the outside is to try and change the way they think and feel first. So to try and give them a reason not to think that way. And that sometimes people will be confused with you. You'll be there going, I'm scared. And they'll be going, but there isn't actively presently anything wrong. So why are you scared? You shouldn't be scared. That's what's going on. But you hit the nail on the head when you described you can't compare your circumstance to anybody else's. So your miscarriage is not the same as anybody else's. The way you miscarried, even sort of how scary it was, how dangerous it was, that's going to make a massive difference. It's going to hit you in a different way. There's also what you bring into it before. So quite a common aspect of it is feeling like it was your fault. And you're more likely to take it that way if you are somebody that always puts responsibility on yourself. And again, that's not you being weird. That's come from your history too. Is if I always feel responsible for things, or if I always have the approach that if I just think about things and approach things correctly, I should be able to make them work. Unfortunately, that just doesn't work with bodies, or pregnancies. But if you've taken away the message that what if I did something wrong? That can often account for some of the anxiety in the next pregnancy, because it's almost, I'm so afraid to do anything. I don't know what to eat. I don't know how to move. I don't know what kind of things is okay to do. So sometimes addressing that, the idea that it was your fault, is huge too. And again, as partners and friends, you're not a trained therapist to try and kind of get under the heart of that, but just to understand that however this woman is feeling, she will have her reasons for feeling that way. And if I can start with that, I'm actually more likely to be able to kind of join her first and then ask her to come and do something with me, or even just being heard can bring you down from here to here, actually. Even just that.
Absolutely. So we're here to hear, here to listen.
Yeah.
Yeah, you are, and we are. So I think we've sort of come to a natural end of this conversation, Ted, and I'm so appreciative that you took the time. And I'm also very appreciative to Catherine, who's sitting on my left, unseen, but she is supporting me morally. You know, I will always dive in if I get the tech, she will dive in if I get the tech wrong. So thank you, Catherine.
Thank you for inviting me, and thank you, Catherine, as well. I really appreciate it, because I wouldn't have been able to make it work either. So yeah, really appreciate it.
Okay. Bye.
Bye for now.